Today we're going to talk a little bit about mosquitoes and ticks in East Longmeadow, things that mosquitoes and ticks might carry, ways that you can protect yourself and your environment, and then ways you can protect your health. Well, we'll start here. Mosquitoes and ticks are around. They're everywhere. This year, the CDC is predicting that they're going to be worse than they've ever been. And you live in an environment that, potentially could both contain lots of mosquitoes and ticks. So I think it's great that you're here getting yourself educated. The number one way to protect yourself is I can see some of you have little balconies and little porch type areas, is to make sure those areas don't contain any water. Mosquitoes can breed in the smallest amount of water. Think of a child's toy or child's shovel like that you play at the beach. That can contain water from rain, and if it sits there for more than a day or two, mosquitoes can breed there. It's really striking how little water you need for mosquitoes to start breeding. So the number one thing that you guys can do for your environment is to make sure that the areas that you live in don't have that standing water. It's a little different for you because you guys here don't have bird baths or gutters or pools that you're responsible for maintaining. So I think that would be great for you guys. And the other thing that you guys can do in your environment is any rips that you might have in your screens. It's great on these cool nights to keep the windows open, but if you have any rips in your screens, they can find their way in, and that's one of the second thing you can do in your environment to help protect yourself. So arborvirus. Arborvirus is a virus that can be spread by any mosquito or tick. Some examples of that are West Nile virus. You'll see that referred to as WNV. Eastern equine encephalitis, that's referred to as EEE. And then we have the tick-carrying arborviruses, which is Lyme and Babiosa, and there's a few others, but those are the ones that are known around here. Also, in the last couple years, you've heard a lot about Zika, right? Zika virus. Zika, the mosquitoes that carry Zika can't survive in our type of environment. Okay, so there may be one or two of them that get brought in here with people who have traveled or tires or some random things, but this isn't an environment that's going to breed Zika. If you have someone you know or love that's pregnant and going to somewhere warm, somewhere down south or islands or other places that are known to have Zika, it's important that they talk to their physician before they go.
Is that what happened for the Olympics down last year?
When they were in Brazil?
Yeah.
There was a lot of concern about pregnancy because Brazil has Zika. The mosquitoes that carry Zika.
Yeah, that's where we heard about it.
Yeah. So the way that actually mosquitoes get infected with Zika is by people. The mosquitoes don't carry the Zika themselves. So what's really interesting is if I'm a person infected with Zika and a mosquito bites me, they now carry Zika. It's not endemic into the mosquito. So that's how that perpetuates itself. The West Nile virus and EEE, this is another thing that is commonly not known, is West Nile virus EEE isn't really active until July and August. So one of the things we'll talk about later is the mosquito spraying that we used to do out of the helicopter every spring to treat for the mosquitoes. Well, if we're looking at virus that's not emerging until July or August, and we're treating in April, it really wasn't really that effective at controlling any of the problems. Next page. So a little bit about West Nile virus. Mosquitoes that carry West Nile virus are the most common for our area. Those are the ones that breed in the bird baths, the buckets of standing water, tires, gutters. So those are the ones we're going to find in our area of the state, is the West Nile virus mosquitoes. There's a lot of talk about it. 80% of people who are infected with West Nile virus don't ever show any symptoms. They have it, it's in their body, and they move on. 20% will have flu-like symptoms where they start to feel the aches and pains in their body, some swollen glands, body aches, fever. That's about 20%. 1% are the people who are going to get really sick from it. And that sickness usually develops in 2 to 14 days after the bite. Okay. So then the other one is Eastern equine encephalitis, that also known as EEE. The first symptoms of EEE are a fever between 103 and 106 degrees. So if you spike a really strong fever and you're not really sure why, this could be one of the things that they're looking for. While EEE is talked about, again, it's extremely rare. Only 30 cases have been diagnosed in Massachusetts since 1990. So I wasn't even in high school yet. So since in that time period, only 30 cases. Any questions on mosquitoes before we move on to ticks? No? Okay. All right, so ticks. There are 3 common types of ticks. The black-legged tick, those carry your Lyme and your Babiosa. And the Lone Star tick and the American dog tick. We're going to talk mostly about the black-legged tick. The black-legged tick, in order to survive, needs to have a blood meal at every stage of their development. Their life cycle is usually about 2 years. And ticks cannot fly or jump. It's a misconception that ticks can actually jump onto you. What they do in order to get onto their host is they stand perched on the tip of grass or at the end of a bush or shrubbery, and that's called questing. So they stand there and they wait for their human or animal host to walk by, and they latch on at that point. So you don't have to worry about it jumping onto you. It's going to come on that way. That's why dogs get it a lot, because they're lower to the ground, they're lower to that grass. So when you come in from inside, one of the things we recommend is doing a tick check right away. So say you're outside gardening or you go for a walk with your friends, one of the things that you can do to protect yourself from ticks is when you come inside, you take off those clothes and they immediately go into the washing machine or on your dryer on high for 10 minutes. And what that will do is that will kill any of the ticks that are on your person. But on your body, what you want to do is do a once over. Do it in the shower or by the shower, check. They're oftentimes along the hairline or in your hair. So your friend who had it on her forehead, that makes sense because they like that area. In your ears or around your ears. I know, it's so gross. Underneath your armpits, because they like that dark, warm area. Belly buttons, and between your legs. So those are common areas if you've been outside a lot and you're concerned, those are the areas that you would check. And it's important to do that right when you come inside. You don't want to come inside after a morning stroll, spend the day hanging out, then try to do it before bed, because you want to try to get that as soon as you can. Ticks usually take at least 24 hours to transmit any of the viruses that they're carrying. So the sooner you can identify that tick and get it off of you, the less likely that you are going to be to get sick from it. So CDC recommends to do that tick check within 2 hours of coming inside.
You're talking about going into the woods and walking, right? You're not talking about just
No.
could be anywhere.
Pine trees.
Yeah. Yeah.
Wow.
There was people in this complex, cause March was a mild month,
Mm-hmm.
April was terrible, March was a mild month.
Yeah.
That there was a lady here that had a tick, probably from her dog.
Yeah. Early spring, you'll start to see ticks reemerging in early spring. We skipped around a little bit, but above the tick checks, you can see the life cycle a little bit of the tick here. So they are the egg cycle in spring, and then they are larvae. That's when the mice carry them around and bring them the larva places. And then they become nymphs again in spring. So that's why you'll start to see a reemergence of them. Most ticks are found in spring and summer. Yeah?
I just want to ask a quick question. If you do see a tick on
Yeah.
you, and you remove it or whatever, should you call a doctor right away?
That's a great question, and we will get there. And if I don't answer it when we do get there, you can ask me again.
Okay, one more thing. So I heard that the ticks are out about this time in the springtime,
Mm-hmm.
and then when it's hot in the summer, they don't bother you. Is that true?
They're less prevalent in the summer, but they are still around. Yeah, but they're
Because
less
you
prevalent.
know what they suggest, like treating the dogs and stuff like that. It's usually springtime and fall.
You should treat your dogs I treat my dogs all year round. If you have an animal, I would recommend treating it all year long. Because you could take your dog out and there could be snow and your dog will come home with a tick on it. Yeah. So for your animals, I recommend treating all year. Yep.
How does the virus, where does it come from to the tick?
Right. So the warm-blooded mammals, so they'll connect to like a deer. That's why they call it deer ticks. The deer will carry the Lyme disease. It will infect the tick, and then when the tick then leaches onto you, that's when they will pass it on to you.
So the tick has to get it from something else.
Correct.
It isn't the tick itself that transmits it.
The tick is not inherently born with it. It will get it, but it is the transmission.
Okay.
Yeah. So that's why they call it deer tick. They're getting the Lyme from the deer. Okay. Most infections occur in the late spring and summer, but again, they reemerge in the fall. So as that weather starts to cool down again, there's another resurgence. So if you can remove those ticks before that 24-hour mark, the less CDC says that you're greatly reducing your chance of getting any of the disease.
Is it true you have to get the head out?
The next question is how to remove a tick.
Oh.
So you guys have great questions. Luckily, I had to thought of some of them. They do want you. It is best if you can get the head out. Yeah, I know. I'm sorry that the print is small. I should have made it a little bit bigger, but it is best for you to get the head out. But if you can't, the CDC doesn't recommend sitting there with the tweezers trying to scrape it out. Your body will expel it, but it is best to get the head out. So, how to remove a tick? Yep.
Before we go to that.
Yep.
It says here, wash clothes in hot water or tumble dry. We'd have to be nude in order to do what it says. None of us have washing machines or anything. We would have to get in a tub or something like that.
No. So you would go home. You take off your. Where did you have like a common laundry facility?
Yeah.
Is that over here? Yeah. So you put your clothes into whatever you bring over here, and you come over and do your load. You try to coordinate to do that.
And get dressed first.
Yeah. Don't come over nude, because then the police is gonna call me and say, "Why did you tell those people at Brownstone to do their laundry without clothes on?" So, how to remove a tick. So this is recommended by the CDC. So you want to start with fine tip tweezers. If you don't have them, I recommend getting a pair. That way you're not trying to search for them. Or you can call your friend, I guess. Someone might have it. And you want to grasp the tick as close to your skin as possible. Okay, that's going to give you the most chance of getting that head out. You're going to pull straight in the direction of the tick's gone in, so straight up with even steady pressure. Okay? Again, you want to try to get the mouth out, but if you don't, your body will push it out. Yep. Okay. Number 3. After removing the tick, you want to thoroughly clean your skin and your hands with either alcohol or soap and hot water. Now, step 4 here says to dispose of the tick by submerging it in alcohol. I have a better suggestion for you. The town of East Longmeadow the health department has collaborated with UMass, and we can send any ticks that we find on ourselves or our dogs to UMass for $5, and they will test it for you to see what it might be carrying. That way, if it does have Lyme disease and it was on your body, you're able to tell your doctor, this tick was on me, had Lyme disease, what is our best steps? It gives you another diagnostic tool. It helps you identify what might already occur. Sometimes it takes a while for that bullseye to form, and that whole time that bullseye is forming, your body has Lyme inside of it. If in 3 days you can get a response to what that tick had, it allows your doctor and you to make a better, faster choice for what treatment options might be best for you. I do have books here about that program. I'll hand them all out to everybody. Inside the book, there's also a tick identification tool that is helpful. If you find something, you say, oh, what is this? Is it a tick? Is this a spider? It helps you to identify it. And it also goes through the process of how to send that tick in to UMass. It's a great program. The CDC, because it is such an emerging threat and because there are such high risks this season, the CDC has given UMass a grant to do the highest level of testing. So what would normally cost $100, they are paying to do half of it. And the town is paying for the other $45 of it. So you're getting a $100 test for $5. And that will basically really help identify what we have in our town. So what the town gets out of it is, from a public health perspective, we're able to see what the ticks in our area have, where people are picking them up. Because it will ask you, where do you think you got this tick? We start to see there's lots of ticks coming from Brownstone. We might start to do some more outreach prevention, and Talk's here to help you guys protect yourself. So that's one of the other things that this program is really great for. And I will pass that out.
I thought East Longmeadow was spraying.
Well, so we talked about that. We don't do the spraying from the helicopter anymore.
Oh, you don't?
No, and we can. That's another part on here, but that never assess the ticks. BTI does not affect ticks at all. Okay. So how you send your tick to college? 4 simple steps. You take that tick that you've removed, you put it into a Ziploc baggie. You go onto the website here, and if you don't have a computer or you're not familiar, you can call the health department. I have business cards here. we will help you through the process. We will set it all up for you. So you don't have to worry about it if you're not computer savvy, okay? We can help you. Once you complete that process online, you pay the $5. They'll give you an order number. Put the order number in the bag, put the baggie in an envelope, bring it to the post office, okay? The address is here, so if you do feel comfortable going for it, the address is here, as well as the address will be in these brochures that I will hand out and leave for you. And then finally, the next step is always, if you have a medical question, always call your doctor. This is not a replacement for medical treatment. This is just a help and a diagnostic tool. Okay, so, yes.
If you have a tick and you want to send it out to be tested.
Yeah.
Does that mean put it in a plastic bag or something? Do you still put it in alcohol?
You can put it in the freezer. They can test even the leg of a tick. These people are pretty advanced.
I thought maybe the alcohol might destroy what.
Nope, they can test it. I think they prefer not to be in alcohol. I think it probably makes their testing easier. Prevention is key. Really, we've been talking about ways to what to do with ticks when we have them or find them on our clothes, but really the best way to protect ourselves from mosquito ticks is to prevent them from even getting on us in the first place. So there are some ways that we can help with that. So if you know you're gonna go outside, you're gonna be gardening, you're gonna go for a walk, you're gonna have a picnic, wear long pants and long sleeves, right? It's might seem tedious if it's hot out, but it really will help you. And if they're light in color, you'll be able to see the ticks on you, right? So ticks are very, very small. They can be as small as a poppy seed, these ticks, right? So if you have clothes that are light in color, if you're wearing a nice light shirt like this, you'll be able to see that tick on you, even if it's the size of a poppy seed, because they're going to stick there. You're going to see it. For mosquitoes, avoid the outdoors from dusk to dawn, right? Mosquitoes that carry West Nile virus are most active in the evenings. I know you guys will probably all have your parties out here at night, but if you can try to avoid dusk to dawn, your mosquitoes will be less likely to bite you. And then the final thing that the CDC says the best way to protect yourself and your family members is by using a bug repellent, such as one of the common ones is DEET. And what they DEET. So two treatment methods. So we have permethrin. This is one that people haven't often heard of. Permethrin. It's listed here. Permethrin is something you would treat your clothing with. So if you know you go for hikes, or someone who likes the outdoors, or you garden, if you find the pair of clothes that you're going to do that most common in, you can treat it with permethrin, and it's available at outdoor stores or Amazon if you shop on Amazon. And it lasts for multiple washes. So some of them even last for up to 30 washes. You would treat your clothing with this, and that way, what's great about permethrin and different than DEET is permethrin actually kills the mosquito or tick on contact. So if you've treated your pants and your socks and your shirt with permethrin and a tick were to crawl on you, it would actually kill the tick.
What is that, a spray?
It's a spray, yep.
What does it do to your body?
You don't put it on your body.
No, I know, but the clothes is on your body.
The clothes is on your body.
Outside, yeah, you're doing the outside of the
Yeah.
clothes, not the inside.
Yep.
Yeah, just spray the outside, don't spray the inside.
And if you have quite
If I'm
EPA,
bad, I call you.
What'd you say?
If it crawls in there.
the EPA has done testing on this, and if you are computer savvy or you'd like some help looking at, I can help you look into what the testing that they've done and things that they recommend. But this is one of the things they recommend. Again, it's only for your clothes. It's not for your skin. You treat your clothing. And then the other treatment is DEET. So DEET we've heard of. This is the most common ingredient for mosquito repellent. The CDC has done efficacy tests. So anything over 50% DEET is not known to be any more effective than any of the other DEET. So you might see DEET that's 75, 99%, and they're charging you a lot more for it. But in the CDC testing, anything over 50% is not more effective. And unlike the permethrin, DEET is effective by masking our smell, what they smell or what they are attracted to us. The DEET masks that, so they're just not seeing us as often, as opposed to killing them. So it repels them; it does not kill them like the permethrin does. Okay, so a couple of people have brought up the spraying that we used to do from the helicopter, right? The BTI every April that we used to do. Last season we changed that method, and what we did last season instead of spraying was we tracked the mosquitoes in certain areas of town to see how prevalent they were and what they were carrying. So we were spraying in April and not knowing did they have West Nile virus, were they even there? And what we found was, of all the mosquitoes that we trapped, only 5% of them were caught or trapped in June. So that's 5% of the mosquitoes were trapped in June, and we used to spray in April. Okay, so the amount of mosquitoes that we were actually treating for was low. The other thing is that BTI that we sprayed was effective for 3 to 5, 7 days max under ideal conditions, no rain, dry. And it only targeted the larva stage of mosquito development. So there are 4 stages to mosquito development. That BTI that we sprayed from the helicopter, for that very small window and very early in the season, targeted 1 stage of development of the mosquito. So through that data, through conversations with the state epidemiology lab and other communities, we determined that our approach was not an effective, efficient way to control mosquitoes in town. And really what the state recommends is doing education and outreach like this and doing surveillance of the data, of the population. So one of the things that we did last year, so we paid a company to come in twice a week. They would come on one day, put the traps out. The traps would collect the mosquitoes overnight. They'd come back the next day, sort the mosquitoes. So we were specifically looking for West Nile virus since it's what's most common here. They would sort the mosquitoes into the breed that commonly carries West Nile virus, and then they would send those mosquitoes in pools of 50 to the state epidemiology lab in Boston. While the mosquitoes were in Boston, they would test those to see how many of the mosquitoes they were receiving contained West Nile virus, or were a threat to us. And what we found was the first mosquito that we found in our community that had West Nile virus was actually July 27th. So now we can think if we were treating in April, and not only were the mosquitoes weren't there in June, they were increased to 21% in July. And it wasn't until the end of July that we had our first positive hit for a West Nile mosquito. Okay, so that was more evidence that for us that what we were doing wasn't really an effective way of protecting our residents. So the other thing that we decided to do is we treated controlled methods. So last year we treated catch basins. So catch basins are positive breeding grounds. They contain all that water that isn't going anywhere, it's stagnant. Mosquitoes go in there, they lay their eggs, and it's just a vicious cycle all year round. So what we did is we treated those catch basins. Instead of the 3 to 5 days or 7 days max that the BTI from the helicopter treated, these were 120-day pellets. So it basically, for the duration of the summer, knocked out any of the catch basins that we treated from being positive breeding grounds for these mosquitoes. Now, we think that that was a much more effective way of controlling mosquitoes in town. The program continues to evolve. This year, we're going to do more trapping. The state actually is going to come in and trap for us for free this year. And they're going to trap for more than just West Nile, which is what we were testing for in the past. So this is a really great opportunity for us to get more data on what exists for a threat in East Longmeadow. We're also working with a company to treat more of our catch basins. We want to make sure that those areas that people are around are treated, so we're not breeding those. And we're also looking into this season, because we have a little extra money from the state coming and doing our surveillance for free, is we're looking into possible tick control measures and what that might look like in the town, since ticks are an emerging threat. I don't have any data or information on that for you right now, because we're still trying to develop a program, but that's one of the things that we're looking to do for the residents of East Longmeadow. Again, any treatment that we do is only a portion of the battle. Really, the most effective treatment is for the environmental changes that we can all make in our yards or our environment to prevent these breeding grounds from starting. If we can stop these mosquitoes from breeding around us, where people live most commonly, like in around your houses and yards, that's going to be the most effective tool. It's not treating from a helicopter, it's not the catch basin treatments. It's really, that is how you're going to keep yourself and your family safe, is keeping your environment as clean as possible with standing water. Okay, the other thing that we're doing in town for mosquitoes and ticks is, well, mostly mosquitoes, is we're joining a mosquito control district. So all other parts of the state has a regional mosquito control district, except for our area. Hamden, Hampshire, Franklin don't have mosquito control districts available to them. So I've been part of a coalition to look into that. We've been able to secure $100,000 from the CDC and $150,000 from the state to start this mosquitoes control district. What this will do is, we're the only community in the area that's doing, we're the only Hampden County community that I know of that's doing any kind of treatment or surveillance. I know Northampton is doing it in Hampshire County, Deerfield and Greenfield are doing it in Franklin County. What this allows us to do is open that treatment option up to our neighboring communities. It makes us safer. We don't only live in East Longmeadow. We don't only play and do things in East Longmeadow. And the mosquitoes, they don't know boundaries, right? We can treat Longmeadow doesn't treat, Summers doesn't treat, it's not as effective. So this will allow us to open those treatment mechanisms and control mechanisms up to other communities, and it'll also hopefully reduce our costs dramatically from what we've been paying, because we'll be part of a whole versus a whole in of ourselves. The town of East Longmeadow, so I've been nominated to the commission for this mosquito control district, and I'm hoping that allows us to be, East Longmeadow to be on the cutting edge and on the forefront to bringing these surveillance and control methods to our residents.
I've been concerned about two areas, two places in our area.
Mm-hmm.
Has the quarry here ever been checked?
The quarry was not part of the surveillance last year.
Will it be?
I can talk to the state, they do what's called a habitat assessment. So they look at our whole community and they look at where are the most common breeding grounds and where is the most danger present. And that's how they choose where to do the trapping. I can certainly raise that as a concern for them when we do it, when I talk to them.
There's one more area.
Mhm.
We have a brook here that goes along under the street coming in.
Mhm.
And it goes along, I'm up on the hill over there, and if you go down, there's stagnant water.
Mhm.
And I was wondering if that's a possibility for them to check, because it is stagnant.
Good. Okay. I don't choose where they go, but I can certainly raise that as areas of concern when I'm discussing with them. So it's the state Mass Department of Public Health that does the actual trapping this year. So you're saying there's a quarry in the back, right across the road,
And the quarry, and there's a brook
a brook.
that,
It runs through.
if you come up Pleasant Street
When it's
and
running.
you come in, there's a brook.
Okay.
When it comes up and around.
It's Pecosic Brook, and this is Worcester Quarry.
Yeah, well,
What's the name of the brook? I didn't know it had a name.
Pecosic.
I didn't know we had a brook.
The things you learn.
I mean, it's close to the road.
Uh-huh.
It's not that far from the road, and then it goes down.
The quarry.
Yes.
One area that you didn't mention, do you remember the big, I don't know if you remember, the big tick thing at Cranes Beach in Ipswich one year? It was infested with ticks.
I don't remember that.
And because you have a lot of that low growth that
Yep,
you're
the
walking
low
down
growth.
into the beaches,
Yep.
and they had to close it.
Wow.
I mean, that was years ago.
Mhm.
But that's something you think of going to the beach, you'd be safe there, but.
Yeah. No, it's that
Yeah, a lot
low-lying
of
brush
low
growth
when you're
area.
walking to the beach, and that's perfect.
Yeah. Yeah, really, anytime that you're spending time outdoors, that tick check when you come back is gonna be important. Especially with the tick testing program that we have. If you find it, and we can send it in, you're gonna have more information than you would have normally.
That's amazing.
Is there an explanation why it seems like ticks are way more prevalent than ever in our entire lives?
You know, CDC has put some reports out. There was actually one in the New York Times a couple weeks ago. They don't really have a good explanation. Some of them there's reforestation, right? So there's a trend not to cut down trees, keep areas green, good for public health, good for a lot of reasons. But no one really has a good answer.
But it is true that, like, when I was a kid, I never saw a tick.
Yeah.
Now I get them on me if I walk in a meadow or something.
Yeah. No, a lot of the mosquitoes have been kind of that big public health, sun protection of mosquitoes that we talk about in the summer months. And really, I think we're gonna see ticks are gonna be the thing, the concern. But the good thing is we can protect ourselves. We can protect ourselves. It's a little bit easier to protect yourself from ticks than it is mosquitoes because we can do the tick checks. We can check our body. We can't see them all, but we can check our body. Mosquitoes, it's harder to do that. Once they bite you, they bite you. But you have 24 hours to get a tick off your body before it transmits something like Lyme. So that's the message is today that I hope is getting across.
Do they
Or one of
itch
them.
does it itch, like say you get it on your back or something and you can't see it? It doesn't itch or it doesn't
No.
let you
It's
know
not like
that
a
it's
mosquito
there?
bite. No.
No.
You just
But
feel
y-
something.
Yeah.
Well, no, not on your back.
Yeah, you feel it.
But you start to get a ring around it, you
Yeah,
start
but it's in
to
your
get.
back and you can't
That's
see
after
it.
it falls
Well,
off.
then you have to have somebody check you every day.
Oh, boy.
Well, I don't know your name. I'm sorry. What's your name?
Elaine.
Elaine. Elaine mentioned how are you gonna do a tick check if you're living alone, right? So I think that's a really great question that I wouldn't have ever thought of without coming to talk to you guys today. And maybe that's something I can bring up with the senior center nurse, is that if you've been outside and you're concerned about wanting a tick check, that we can't do the thorough tick check, but we can check, the back of your hairline and your back, and I will bring that up to the senior center nurse. That's a great potential program.
Jessica, you can all check us in.
You'll have a line out your door, Jessica.
No, but I tell you something, just this spring, I was working outside, it was Saturdays and I don't know. Anyway, worked outside for several hours and it was still cold, so, long pants, long sleeves and all that, so. Anyway, came in the house after, I took off my pants, shook them outside and everything, went and got different pair of pants, put it on, for evening or something, then I'm going to bed and I'm looking, and on my leg, there it is. So think about it, I had long pants and I didn't lay on the desk for God's sakes, and I was working, right? And, somehow it did come up, then I took off my pants, and put something else on, and it didn't break my skin because you were right, it didn't break my skin or anything, I didn't feel it until I saw it.
Mhm.
I must have, somehow, so I took it off and, flushed it and that was that.
Yep.
But it just made me think that, even though I had long pants and everything, still didn't help.
Yeah.
So if
Well-
she had taken a shower, it would have washed it off.
Right, so if you had done the tick check when you came in, so you took off your pants, you shook them off, and you put on a new pair, but if you had done a tick check, you might have caught that, right around your ankle, like where your sock line meets, that warm area. So that's my presentation. Is there any other questions? We've done a good job of asking questions throughout, so I appreciate the questions. Those are great, and they help the presentation be more informative.
Well, before my son-in-law takes his lab in the house, he takes 4 or 5 ticks off every time, and the dog has been out there maybe 15 minutes running around, and that's it.
I took a tick off my dog last weekend. It's and he's a dark colored dog. I only knew it was there because I felt it.
Now, is that the dog, like the ones that come from the dog?
Mm-hmm.
Would that affect a human if it had landed on you?
There are
I mean,
different
they're free.
types of ticks, right?
Yeah,
So it
it's
would,
really different.
yeah, there is a tick called I believe called a dog tick. It's not just specific to dogs.
Okay.
One of the things here, it says, why don't we spray anymore?
Yeah.
All right, we were spraying at the wrong time,
Right.
but now are we spraying on the right time?
Right, so we can't spray from a helicopter. The reason we sprayed in April is before the foliage came on the trees. Because if there's foliage on the trees, it's not going to make it down to the areas that we're trying to treat.
Yeah.
But then
Yeah.
what if it rains, Yeah.
Right. So what we're doing now is we're not spraying, but we are treating the catch basins with the BTI pellets that last 120 days, as opposed to that short period of aerosolized BTI. We're treating it with the same mechanism, the natural occurring soil bacterium.
So where are the catch basins? Is that like our little brook that's running around?
Catch basins are like the sewer collection areas where the water just sits. And a lot of times what we have is we have like 4-foot sumps where the water sits there until it collects to 4 feet. If we don't get rain very often for a stretch, that just sits there. So if we treat that water, it's whatever little water is sitting there keeps that chemical slowly. It's like those toilet bowl pellets. You know those pellets you can put in the back and it's blue every time you flush.
Yeah.
It's like that.
Okay, gotcha.
Any other questions? Well, thank you so much for. One more.
Do you keep track of how many people get these diseases in your
Yes.
department?
Yes.
Yeah.
So these are listed as communicable diseases. We know who gets Lyme. We know who gets West Nile. Last year we had no human cases of West Nile. I could have brought that data. I don't think we've had a human case of West Nile. Oh, before you leave, take some. Yeah, okay. I don't think we've had a human case of West Nile for a couple years now.
Do you know if they're working on, finding out whether a person has, West Nile virus or some of these
Your
diseases?
doctor would be the person to diagnose that. Yeah.
Well, from what I hear, they're not very good at diagnosing, they miss a lot.
Well, yeah, so the thing is, 80% of people won't know that they have West Nile because they won't have any symptoms. And then the other, almost 20%, will have flu-like symptoms. So you'll go to your doctor not feeling well, and then they'll say, okay, maybe you've got a virus or something. They're not going to test for it unless something is showing them that this might be West Nile. It might be one of that less than 1% chance of it being an aggressive form or treating your body, affecting your body severely.
Yeah, I was just hoping more could be done in that area.
Yeah.
Yeah, because my niece's daughter,
Had West Nile?
yeah. Yes, it was Nile.
Are you talking about Lyme?
Lyme.
Lyme, okay, yeah, Lyme is different. I don't know about the diagnostics. I'm not a doctor or a nurse. I'm not sure about the diagnostic process.
My son's a doctor, and he said some of the insurance companies will not pay for testing for that.
Testing.
Not all doctors, but
Yeah.
some insurance companies will not pay to test for for.
The Lyme. Yeah, I think there's a variety of diagnostic tools. So I think there's a blood test.
Yeah.
I think they can test your spinal fluid. But I think the first thing they look for is that bullseye rash, which that's a visual, that's not necessarily a test. So maybe the insurance companies are relying on doctors to see that. I can only guess.
My son got that and he had to go on antibiotics for
29 days, 28 days. Yep, it's a course of treatment.